muscle techniques that I use here in the office is called instrument-assisted myofascial release. And similar to active release technique, what I do primarily is I will look for an injured area that has developed some sort of knot or gristly type texture, whether it was a more recent injury or an injury that occurred a while back and tend to form scar tissue. And typically that kind of tissue, when it's in a healing state or an improperly healed state, the tissues, rather than being aligned horizontally and longitudinally like they should be, like that, they tend to form a little haphazard crisscross fashion. So what I do here with instrument-assisted myofascial release is I will get a tool such as a Graston instrument or scimitar or washout tool. In this case I tend to use a scimitar, which I'll show you now. It looks like this. It has multiple treatment edges and it's lightweight, made of aluminum. And what we do is we will do a scraping motion in various angles, and that will tend to break up the adhesion that had been crisscrossed, kind of break it apart and allow the fibers to come back longitudinal as they were meant to for proper healing. So what we'll do, I'll show you on the patient here, is get our tool, get some sort of emollient like this in order to minimize the skin friction. And we will get a little bit on there and you spread it over the area of concern or injury. In this case we're working on the patient's calf today. I'll set my emollient aside. And first I'll start with the scanning technique. Very light pressure just to find the area that is most gristly or tends to cause the patient most pain, or possibly also will redden up more than the surrounding area, indicating that that's where our lesion is. So once I've done that, I'll go into the treatment phase where I'll add a little bit deeper pressure. And as I mentioned before, go in multiple directions and use multiple angles here in order to break up the adhesion in all its lines of planes. So oftentimes I'll use almost like a star pattern here, going up, down, side to side. And you usually do this on the patient for about 3 to 10 minutes or so, and that's sufficient to break up that adhesion and allow proper healing to start to take place. So upon finishing that, tend to wipe the patient down so they don't feel greasy from the emollient. And then I'll finish up with a little bit of ice, since I'm inducing a mild inflammatory response in order to generate the proper healing. But at the same time, do not want your patient to be too sore afterward. And usually these type of treatments work with great success and show good healing within 3 to 5 visits or so for milder injuries. But it depends patient to patient.